Good afternoon, everyone, and a very warm welcome to the launch of this year's Clinical Audit Awareness Week. My name is Chris Gush, and I am the Chief Executive of the Healthcare Quality Improvement Partnership, or HQIP. So we're responsible for commissioning national clinical audits, outcome review programs, registry data and resources, as well as a range of other quality improvement and patient engagement initiatives. And it's a real pleasure to be with you this afternoon to help launch this important campaign delivered in partnership with NQI Care. Before we begin, just a few quick housekeeping points. Today's session has been recorded and will be shared on our website and social media channels. All microphones are automatically muted and will respond to specific inquiries after the event. And we'll share an email address at the end if you'd like to get in touch with us directly. It's fantastic to see so many people joining, over 100 now, as we gear up for another impactful week of awareness, celebration and shared learning. Thank you very much for making the time to be here, and thank you for everything you do to support advanced clinical audit across the NHS and beyond. A special thanks to our partners NQI Care for their continued collaboration and commitment to championing clinical audit and quality improvement. You'll be hearing more from Vicky Patel, NQI Care Chair, later in the session. Most importantly, I want to thank you, the clinical audit community. Whether you're involved in the frontline, a quality improvement specialist, a clinician, patient voice, or system leader, this campaign is for you, and it's important that you're here and engaged. Thank you very much. Clinical audit plays a vital role in improving healthcare services and outcomes. It provides the evidence to drive real change and supports learning, transparency, and improved care. Clinical Audit Awareness Week is about showcasing that value. It's about raising awareness, sharing good practice, and strengthening the impact of audit and evidence-informed improvement. And it only happens because of your energy and involvement, running activities, engaging colleagues, and sharing your work online, and to help raise a profile of audit in your organisations and across the system. And of course, this week includes a much anticipated Clinical Audit Heroes Award, which will be open for nominations from the 27th of March to the 27th of April. We'll share more on the awards and the rest of the week's activities later in this session. But for now, I'll hand over to Professor Danny Keenan to share his reflections for his many years involved in national clinical audit and working within the NHS. Danny, over to you.
Thanks very much, Chris, and welcome everybody. I just extend Chris's welcome. It's really great to see you all gather together here in the launch of the Clinical Audit Awareness Week in June. And indeed, this is a launch of clinical audit awareness. So it's not just for the actual week in June, but it's your own celebrations of the work you've been doing in both local and national audit. So please remember to celebrate yourselves locally, what you've been getting up to, as well as of course applying for these awards. So I just got a few thoughts. As medical director at HQIP, obviously I interact with NHS England colleagues who commission us, but also with yourselves. And it's these latter linkages that I find incredibly important and very helpful to really understand the pain that you go through and the work that you do, because without your work, we effectively would have nothing. So it's wonderful to have these linkages with you. Yeah, a few things just to go over. Obviously, we all know there's politics all around everything going on at the minute. That will not affect anything that we're doing. We are sitting in an independent role, commissioned by NHS England, and that independent role is not going to change. So national clinical audit, local clinical audit, as ever, will steam ahead, working with you for the good of patients, outcomes of patients. So whatever's happening around us, we are a fundamental a building block in all of this healthcare that we value so much. Just a few pointers here. Obviously, the history of this, it's a long history, but recently, when Darcy came in and had a look over things with the government changing, the priorities were set out by him and remained as they always have been. And indeed, the audit work, the national audit work that's going on, has been given an increased focus, particularly in NHS England, who've become particularly interested in making sure that the outcomes, the recommendations, the outcomes from the National Audit Programme are being implemented. And indeed, we've just finished a meeting today on going over the implementation by NHS England of the recommendations. As you can imagine, the national audits are being asked to focus a lot on the national recommendations, whilst at the same time the local recommendations we're asking to be going out back to yourselves, but more with tools associated with them, so as you're given the help to make those recommendations locally. Back with the national recommendations, obviously NHS England are now very focused that if there's a recommendation coming out or a guide, that actually they know who's doing what. And that there's a lot of thought going into that. And we've just finished a meeting on that. And so these are taken very seriously. So you can be assured that whilst the recommendation may sometimes be difficult, that there is a group led by Stella Vig, the Associate Medical Director for NHS England, to make sure that these just aren't sat on a shelf, but are actually implemented. I just want to emphasize too, again, in this era of change, that we hear there's a new NHS plan coming out, but the basic building blocks of that NHS plan have already been given to us, and these are on this: from analog, digital, hospital to community, and improved prevention. They don't immediately hit us, but actually when we think about those, actually they are very, very important. Every aspect of our lives is moving digitally, and so it is with healthcare. Many of you will be working in hospitals with EPRs. EPRs, we are hoping, will be incredibly helpful, but they're not a given. So there is work, and we've just started work with one of the providers as to how can we make sure that the flow of data coming out, which will now be coming out as EPRs are implemented, will be of benefit to all of us and will make the burden go down. So that's one thing that we're doing on that. Hospital community, as you will all know, the vast majority of these audits are hospital based, but their implications are for the outcomes of patients, and patients go back into the community and back and forth, as you know. So obviously there's a lot of thought that we with you need to put into this as to the implications from the patient who has left hospital. Like most patients are now spending very short times in hospital. So it's really important that we get this going. And then prevention, again, doesn't strike us immediately in terms of a lot of our audits. But I think as we start thinking a bit more laterally, we can start thinking along the lines of prevention. A few words on the NCAB, the benchmarking tool that we have. Obviously, there have been problems with analytics teams, particularly in CQC. Now, CQC have got their analytics teams working now. So, working now. They've always been working, but they're essentially they have more colleagues working, and that has allowed us to move the data forward to make sure there's more timely data on the benchmarking platform. There is also work now happening, again, with increased analytic personnel in model health. Anybody who doesn't know model health, if you've got an NHS email, you can get access to model health. Model health is working with the audit to bring those in as well, so that you'll be able to see the model health audit results on model health associated with all of the other information on model health. And there's work going on model health, so that there may well be a dedicated area, much easier to access. That's not ready yet, but that's part of the planning. Outliers, one of the big changes that we made this year, and you'll know this full well, is having non-participation being treated equal to an alarm outlier, and that the implementation of that through your work has been very successful, actually. And finally, just want to alert you to the fact NHS England have been running a plan as to having a strategy developed around national registries and audits. The initial work on that is finished. That will be coming out to consultation in the late spring, early summer. So we'll be able to see. I don't anticipate there'll be massive change coming from that, but there will be a lot more guidance associated, and the governance associated with registries and audit will be a lot more clearer. And then I just want to throw that where everybody in the world of clinical audit understands it's not just about measurement and looking at numbers. It's about what happens next, the so what question, quality improvement. That's what's really important following on from audit. If I could have the next slide, please. Just want to leave these questions with you because these are fundamentals. One of our trainee doctors working with us said this to us, and that it's always struck me as true. These are, as you're working in a team, and everybody here is working in a team. You may not be frontline clinical team, but you're certainly working with a team who has a bearing on outcomes of patients. How good are we? We always assume, especially doctors, we're all the best. We do a good job. How do you know that? How good are you really? How do you know benchmark to this, that, and the other thing? Where do we understand relative to the best, which is what benchmarking really does? And the variation, national audit really homes in on variation, and there is variation. It exists everywhere, and the variation is not right because if you've got such and such a condition, you want to make sure that you're getting the right treatment in the right time by the right people, etc. That's so important. And then when you do find variation, how do you improve it? We need to work on that. And are we making a difference? Are we actually improving these? Are we helping the outcomes of patients? These are all the fundamental questions. And next slide, thanks. Okay, so this is where our interface, HQIP with yourselves. We need to hear back from you. We need to hear your thoughts. You will have lots of thoughts about EPRs. Let us know. Are we getting the results out to you in a good way, timely? The infographics, I really like the infographics that we get out now, but is there more we can do? Is there better benchmarking we should be doing? Are the newsletters hitting home? Are there different things that we should be doing? We try and do social media, but we could probably be doing a lot more of it. And then recommendations, we have tightened those down, but can you manage with those? So this is where we're asking for you to tell us that are we doing the right job? Are we doing the right things? So again, fantastic to talk to you. Vicky's going to take over now and take you all about the logistics of the week. But please stay in touch with us and answer these questions and send us back anything that's going on. We need to know from you. Thanks again. Vicky, I'm going to hand over to yourself.
Lovely, thank you, Danny. And speaking on behalf of NQI, we're really pleased that we are collaboratively working again with the HQIP to plan and deliver this national campaign over 1 week in time. I think we know it's really important to our audit community. It captures and promotes everything that we're actually doing every day to monitor, review and improve patient care services and ultimately patient outcomes. So it's a really important week for us. I think now we've got that opportunity to pause and reflect on how much we are actually achieving and the difference that we do actually make to the patients and the public alongside our colleagues and our partner organisations within our systems as well, because this is about supporting across our pathways. So as always, it's that opportunity to really shine that light on how effectively we utilise clinical audit to improve patient care and services. So we've all got those dates. So we now need to start that local planning. So what are we going to do this year then? So from an NQI CAM perspective, over on our Futures workspace, Louise, our comms lead, has set up some clinical audit awareness week folders, and we want to start those discussions going. We're still planning for the week itself, so there's that opportunity for you all really to get involved and help to shape how that week's going to look. What do you want to see, and what can we put in place that's going to support you back in your own organisations and in those systems to take clinical clinical audit forward. So let us know. We want to know your ideas and your actions, and we can all support one another, and let's work together to make this yet another fantastic week. So Clinical Audit Hero Awards then, as Chris and Danny have already mentioned, then they're designed to enhance the way that our audit programs are evolving. And it's that emphasis on lasting change and bringing about change, whether that's local or at system level. So this is your chance to share your amazing work, but also best practice and innovation. So it's an opportunity for you to make that difference beyond your organisation by sharing that work that you're doing. So the nominations open on the 27th of March and they close on Sunday, the 27th of April. So please do make a note of that open date and that deadline, and can you please share it widely with your colleagues as well. There is the dedicated web page where all the information on the Clinical Audit Heroes Awards is available as well. So if we could just move to the next slide, please, then lovely. So you've got the 5 categories across each day of the week. This is your chance to share your work, as we've said. We're looking for projects that demonstrate excellence in clinical audit and/or quality improvement. The awards are open to projects, individuals or teams that are involved in any type of healthcare setting in the UK, whether that's at that local system or that national level. And making a nomination is quick and easy. It's a very few short questions to complete, and we have been reliably informed that it could take as little as 20 minutes. So the nomination forms will be available when the awards open on the 27th of March. So as we've said, make a note of those deadline dates for the awards opening and getting it back in, and please do share this widely. Get your thinking caps on about your entries, and you can enter as many projects as you like, and we want to see you encouraging others to enter as well. So what else is going to happen in the week itself then? So if we could move to the next slide then, we can have a look at some of the additional information. So lovely. So the NQI CAN core team are currently busy planning the daily lunch and learns based around the 5 topics, and we will be in touch with you all to find out who would like to get more involved and how. And we will obviously start to announce those key speakers and how they'll keep us updated on these 5 topics in terms of that strategic direction that we can then take forward within our own organisations. And the links and the instructions on how to join each event will be released soon. So NQI CAN will be involved in supporting HCRIT with the Clinical Audit Awareness Week 25 Hero Awards as well, and the winners will be announced each day at those NQI CAN Lunch and Learn. So please do make a note of the dates and the times in your diaries and look out for those links being shared shortly. Probably worth mentioning here as well that we know through our networking with our community that we've got a large clinical audit programme back in our organisations. We've got high numbers of local audits, some in response to national clinical audits, others in response to local drivers. So amongst those, there are going to be some high quality and effective clinical audits that you can get submitted to these Clinical Audit Hero Awards. So just getting you to stretch your thinking now quickly as well, and your local plans for the week, not just submitting your awards to the Hero Awards and not just attending some of the national events, but what do you need to learn from previous years that you can take forward in terms of your local planning in your own organisations and within your regions? So the 5 topics are set out. So from that patient safety perspective, it's thinking about some of your clinical audits that have either highlighted patient safety concerns or actually clinical audits that are in response to those patient safety concerns as well. Who's leading on patient safety in your organisation, and maybe in the week itself, could they be championing some of the key messages around how clinical audit has supported learning within that patient safety incident response framework and preventing that avoidable harm? You'll have some good examples to put in for the awards, but you'll also have some key individuals that can champion clinical audit as part of your local planning. It's the same for your patient and public involvement as well. Who are your patient experience leaders and patient groups? How are you using the patient experience measures to inform your clinical audits, areas to focus improvement on, and how are you accessing groups and forums and audiences to share your clinical audit outcomes? You will probably have some good case studies and some good projects that you could submit to this, this topic for the award heroes, but also Get your patient experience leaders to be championing how clinical audit is working to improve patient care as part of your local plans. Same for health inequalities as well. Are you linking in with whoever's leading on this within your own organisation? And have you started to look at how you're building those measures into your local clinical audits as well? You might already have some good examples that you could submit to the Audit Hero Awards. And then when we're starting to look at the influence in change, who's leading on implementing that NHS impact within your organisation and system? And how are you utilising your organisation's improvement approach to really influence taking action on clinical audit data? You might have started doing this with some of your topics, and you've got some really good examples of where you've managed to achieve change at across your specialties, at organisational level, even maybe system level, that you could submit for this category. And then whoever is leading on NHS impact or your organisation's improvement approach, how can they champion clinical audit in the week itself as part of your local plans? And then efficiencies then, sustainability, as we've referred to this category in previous years, how we embed in clinical audit as business as usual, how we're trying to reduce that data burden so we can concentrate on getting the outcomes out of our audits and using that for quality improvements. A number of publications we're expecting to be published around the national strategic direction that Danny's mentioned. What do we need to consider now to actually future-proof health and care going forward? And some of that is around technologies and innovations, equity and access. So you might already have some really good clinical audit projects where you've measured how you've adopted, say, some of the nice med techs that you can actually submit into this category. So a really good week for us, I think, to actually showcase all the good work that we're doing every day, but we're tasking you today to take this away from the launch event, to start speaking to your teams and start to identify good projects that you can submit to the Clinical Audit Heroes Award. So if we could just move to the next slide, please. Lovely. So it's an opportunity now to recap on your local plans, but recap on what we did last year in terms of Clinical Audit Awareness Week 24, and just to signpost you back to the recordings of the lunch and learns, the slide packs, the case studies of the winners from last year, and start to think about what you've done with that information since and how can you utilise taking some of that forward within your local plans for this year as well. Louise has pulled together a challenge pack that you can actually download, so that's available on our Futures workspace. We did set your challenges at the end of each lunch and learn around the 5 topics last year. We did tell you to be bold and to be ambitious, and we want to keep that thread going this year as well. So please do head on over and access that challenge pack, and it's available on the HQIP website as well. And really, I just wanted to finish up really with some reflections from feedback from community members from the last few years around how to make the week a success in your own organisations. And a few key pointers are really starting to get that senior buy-in. You've all got an exec that leads on clinical audit in your organisation. How can you get them to support you within that week and start to give out some of those key messages? Even think about putting maybe a one-pager to your exec meeting to ask for the trust to put support into the week itself locally. Now's a good time. We're into March. We've still got a few months to go. Think about where you're going to focus your week. You might pick 1 or 2 topics that are important locally to your organisation, your community and your system, and maybe just concentrate on those. Get in touch with your comms team. This is a national campaign. What can your comms team do for you within your regular comms channels that are set up, that can add some key messages to promote the week and obviously to promote clinical audit? And then think about any of your local plans you're putting in place, how you're actually going to measure the success of those. And then finally, if you really don't have much time and you haven't got much resource, which our members do tell us they struggle with, light touch can be effective. So key messages in comms, posters around the trust, promoting the national event in the week for colleagues to access or listen back to the events that we're putting on nationally, and of course sharing resources post the week to further support clinical audit in your organisation and promote it as that really good quality improvement tool. So this week's about raising awareness. Everything that we're doing every day, our teams don't do this on their own. We do this working within our organisations and our partner organisations across our systems. So I think it's a watch this space this year, because we're going to try and get you to think differently about improving across your systems, and we want you all to get involved with us to make it a really, really good week. So at that point, I'm going to hand over to Lacia from HQIP, who will sum up. So please don't leave us yet. Please do stay with us, because she's got some important information to share with you.
Hello everyone, welcome, and nice to see so many people. So all that remains for me to do is just spend a couple of minutes at the end making sure that I summarise everything that you've heard today and to leave you with all the key messages. So before I do so, we'd love to hear your feedback on today's event. So a link to a feedback form will be put into the chat. So we'd love for you to tell us what you think, and please do use that link and fill in the form. So first of all, the first thing we want to do is to point out that we'd love you to get on board. You've heard that so many times today, I'm sure, but there is a toolkit, a free online toolkit on the HQIP website to help you to get involved, get on board, organise your own local events, your own awards, your own activities, and encourage others to do so too. And that toolkit there is there to help you to do that. Do share information across your teams and beyond. So as Vicky said, ask comms teams to help by sharing content in newsletters and so on. And also don't forget to share your plans with us. Tag us on social media and let us know what you're up to and what you plan to do, and use the social media hashtag CAAW25. Next slide, please, Drew. So other ways you can get involved, or other things you may want to know about, in addition to the toolkit that I've just mentioned, of course, there's the awards. There's 5 categories this year, as you've heard. They're largely similar to last year. The key dates are open for entries from the 27th of March, and there will be forms online from that date that you can use, and information will be posted at the beginning of that week with full criteria. The awards close on the 27th of April. And then we have the Lunch and Learn events, which are going to be run daily, 12:30 to 1:30 p.m. from the 2nd to the 6th of June. And we will also be having lots of other events and activities planned during the week, which we'll share there via our e-bulletin, via our website, and via social media. So do connect with us so you can find out the latest. Next slide, please, Drew. So I think all that remains for me to do is to say it's wonderful to see so many of you excited about Clinical Audit Awareness Week and the Clinical Audit Heroes Awards. Obviously, we're excited too. We're not only excited about the campaign itself and the awards, but what we're really excited about is to have the opportunity to celebrate clinical audit and quality improvement and the impact that it has on healthcare and patient outcomes. It's very much a celebration of you and your work this week, so we're so delighted to have so many of you here today. As such, we'd love to see and hear about everything that you're planning to do, as I've said. Don't forget to look at the website, don't forget to sign up to our mailing list, and follow us on social media, and you will be able to hear all the latest as it happens. If you have any outstanding queries after today, then email communications@hquip.org.uk. A final plea to do please fill in that feedback form. We'd love to hear what you thought of today. And then one final thought from me, which is that we look forward to receiving your award entries, to seeing more of the activities that you're planning on social media, and above all, to celebrating Clinical Audit Awareness Week with you from the 2nd to the 6th of June. In the meantime, happy CAAW25 planning. Thank you.